Well, this is still Prime Morning. My name is Esiodua Akumia. I love to be called the Golden Girl. It's time for Good Living segments. This is a segment that we talk health. Today, we are going to get into the conversation about childhood cancers. I have the right person to delve into that conversation. Today, we are twisting it a little bit because we have a few things to project on here to show you and delve deeper into it. We are also going to continue the conversation pretty shortly as well with the Lions Club members. We have some members here who are going to get into a very interesting conversation with us pertaining to childhood cancers. They have something amazing that they are about doing, and so we are going to get into that. But before we get into the conversation with Lions Club, and also before I introduce my guest to you, did you know that unfortunately childhood cancers is a significant health issue right here in Ghana? And unfortunately, we have been estimated between 1,200 to 1,525 children being diagnosed of childhood cancers under the age of 15. Ladies and gentlemen, I have joining me this morning oncology nurse specialist at the Kolebu Teaching Hospital, Na Mateki. Hi, Na. Good morning. You good?
Yes, I'm good.
Are you okay? Are you fine? Let's check it out.
Fine.
Let's check it out. Right, so today we are going to talk about childhood cancers. I know that this is a subject that a lot of people don't really pay much attention to, but unfortunately, it is happening in Ghana here. And looking at the numbers, that's strange. Every single year, approximately, these are the numbers that approximately is being recorded. But I want you are the experts. Please give me some more details into childhood cancers here in Ghana.
So, like you just said, childhood cancers are increasing in Ghana.
Yeah.
And approximately, we are supposed, because of our population size of about 30 million, using the global statistics to calculate, we are expecting about 1,000 to 2,005 cases to be diagnosed every year. But unfortunately, we are getting less than that. We are seeing less than that in our health facilities. Approximately about 500 to 600 are being diagnosed yearly.
So meaning that there are a lot of people who are unaware and are not coming to hospitals with their children. But there's a high possibility that their children are going through childhood cancers.
Exactly.
Oh, that's not good.
That's not good at all, because children are our future.
Yes.
So once we are not diagnosing them and we are not treating them,
we
are losing our future. So that's something that is very critical. And we need to take a critical look at it. That's why we are doing a lot of awareness creation so that parents, guardians, caregivers will report early to the facility. So that, and with childhood cancer, the good thing about it is that it is curable once it is diagnosed early. It is very, very curable.
Thank God for Jesus.
Once it is diagnosed early. So we need to create a lot of awareness so that individuals will visit the health facilities very early so that they receive the right treatment. Okay.
Now, let's delve deeper into what childhood cancers are. If you can have, the slide that Na can... okay, all right. So now I want you to just brush on it for us. What really is childhood cancer whilst we get the slides ready for you?
Okay, great. So cancer is any abnormal growth. So our body is made up of cells. So the cells come together to form tissues, and the tissues come together to form organs and forms a system. So we have cells everywhere in our body. So when these cells, there's a mutation. Mutation means there's a change from the normal cells. And this change continues to grow. Then it causes something called a tumor. Initially, it can become benign. That's when we know then they'll do maybe a surgical treatment, and that is it. But when it becomes cancerous, then these cells tend not to listen to the body's mechanism, but they have their own way of producing their own blood vessels and now not deviating from the body system, which means that they are not aligning to the body mechanism. Okay. So now what happens is that this cancer tends to overtake the body. Now then the body doesn't, your organs will not be functioning as it should. Exactly. So if it should start, and because we have cells everywhere in our body, so you see, so normal cells, and they can start anywhere. So when they decide to grow and multiply abnormally, and they overtake the body system. Okay. And like you said initially, 40,000 are supposed, globally, we are expecting 400,000 children to be diagnosed with cancer.
Okay.
And in the high-income countries, 80% are cured. 80% of the children diagnosed with cancer are cured. And out of this 400,000 children that are diagnosed, about 40% are diagnosed in low and middle income countries.
Right.
Okay, and our survival rates are very low.
Yeah, between 15 to 45%.
Exactly, compared to 80% in the developed countries.
Yeah.
And like in Ghana, we have no data because we have no registry. And like we have said...
Are we still battling this in hospitals? Because a lot of the times when we interview, specialists like yourself, it's one of the issues that they bring up that there's no specific or correct statistics or data that is collating all these things. So even when they mention numbers, it's not really accurate.
The exact thing. Exactly.
Oh, that's sad.
Yeah.
Well, let's see. Let's move on. Okay.
One major cause of the low survival is due to late reporting. They come to the hospital at very late stages.
Okay.
Mostly when the cancer has metastasized. When we say metastasized, it has spread from...
Metastasized.
Exactly.
Okay. We are learning something today, viewers. Okay.
It means that the cancer has spread from where it initially began and had moved to other organs. For example, if it started in the kidney, now it has gone to the liver, or probably has gone to the chest. So it makes it very difficult to treat. The treatment has to be
when it moves from one organ to the other, does it leave a little bit of itself on the organ before it moves?
Yes, so there are ways by which it moves. It can move through the blood. You know, the blood is flowing. So as the cells get into the blood, it can move through that medium to maybe the liver, because blood has to go through the liver also. Blood has to go through the chest.
So your kidney
the cancer is there. Cancerous. Exactly. And then it moves to another organ.
Right.
Then the other organ also is infected.
Wow.
You understand? Wow. And WHO, World Health Organization, came up with an initiative to help low and middle income countries.
Okay.
So that the initiative is called Global Initiative of Childhood Cancer. And the goal is for us to achieve 60% of survival by 2030.
Okay.
And we are in 2025, and we are still battling around 30%.
Well, there's still hope. We have 5 more years to go.
And there's hope. Yes, once we all work together. Yes, once we work together, there's hope.
Yes.
So I just want to say that the cause of childhood cancer is not known. We don't know what causes it.
Okay.
And like we all know, there's something we call predisposing factors. Because we don't know the cause. There are things that predispose these children to the cancer. And environmental factors like radiations. We've had radiations everywhere, which can cause mutations to these cells. Infections can cause children to be predisposed to cancer.
Okay.
Then certain chemicals can predispose our children.
Okay.
Then there's something we call genetic factors. So genetic factors means that there's something running in their germline that are causing these children to be predisposed to cancers.
Okay, so infections and then viruses such as HIV, hepatitis B,
hepatitis B. Once these children are predisposed to these viruses, they might come down with cancer.
Okay.
And unlike adult cancers that they are screening modalities, so here in October, they are screening all sorts of names, Pinktober, Pink October. Then they can screen for cervical cancer. You heard of it last week, they were screening. Unfortunately for childhood cancers, we can't screen. There's no screening modality.
Oh.
Which is very sad.
How come? Why?
Because most of the signs they come up with are similar to their other childhood infections, other childhood diseases.
So it will be very difficult to detect?
So, yes, it is very difficult to say that because they are showing this sign, it is cancer.
Oh.
So we have come up with early warning signs. That's when parents or guardians see they're supposed to...
But wait, before you continue, then it validates a lot of parents' reasons for not bringing their children to hospital.
That is why
we see any early signs.
Yes, so that's why we want to talk about these early signs. Once you see it, just don't go to the pharmacy or the chemical shop to buy any drug and just give to the child.
Okay.
Go to the health facility because there are doctors, there are nurses who have been trained on these things so that they can pick it up and do the right investigations so that it is diagnosed early.
Okay.
So I just want us to walk through the early warning signs.
Okay.
So S meaning seek help for any persistent symptoms.
Okay.
So if you have a child who has any persistent symptoms or sign, you need to seek help, go to the health facility and let them run a lot of investigations to see what is happening, why this child is having this specific sign. Then I meaning for any eye sign. So if maybe there's any whitish spot on the eye, if the eye is red, if there's a squint, if there's blindness, if there's the eye is bulging out, it is not normal. So send the child to the hospital.
Right.
If there's any lump anywhere in the body, either in the neck area, in the abdomen, in the groins, anywhere in the body, once you detect any lump, please send the child to the hospital.
Okay.
Then you meaning you for unexplained. So you have unexplained fever, for example, fever lasting for more than 2 weeks. You go to the facility, they run some tests, they give you some medication, you go home. The following 2 weeks, it starts again. Please don't sit in the house. If you have a child who is eating and yet the child is losing weight, any child who has, children are very active. They would fall at some point, they'll hurt themselves.
Yeah.
But that child shouldn't, if there's a cut or a hurt,
it shouldn't take too long to heal.
bleed for a very long time.
Okay.
When we put pressure on it, after a few minutes, it's supposed to stop.
Right.
Once it doesn't stop, make sure you send the child to the nearest facility to be examined.
Okay.
Children are very active, like I said, so they play a lot. But some children, once they play, after a very short time, after 5 minutes, they start saying, Mommy, I'm tired, I don't want to play, they are very weak. All these things are similar to other diseases. So we need to send the child to the hospital.
Okay.
So A for aches in the bones, in the back, anywhere, or any child who fractures easily.
Okay.
Then N for neurological. So a child having any neurological sign like change in the way the child is walking. Constant headaches, early morning vomiting, those things should be investigated to find out what is happening.
Okay. All right.
And there are different types of childhood cancer.
Okay.
So depending on where the cancer starts, that's the name given to the cancer. So we have cancer of the blood, we call leukemia.
Okay.
Lymphoma is cancer of the lymphatic system. You have retinoblastoma, when the cancer starts in the retina of the eye. Nephroblastoma in the kidney, then osteosarcoma in the bone. So the first four are the commonest ones we usually see. Okay. But currently,
we usually see here in Ghana.
But currently, leukemia is the commonest cancer, which we have about 32% of all the cases that come to the hospital. They have leukemia, cancer of the blood. Yeah. So the treatments, what you do when you go, they'll let you do some labs. We'll do some investigations to find out what is being done. And the major treatments for childhood cancer is chemotherapy.
Well, before you continue, some of the children that have, a part of the intestine sticking out and all of that.
That is not this one.
Okay.
That's not cancer.
All right. That's cool. Okay, so what doctor or nurses do? Okay, let's come to treatment.
Yes. So the commonest treatment for childhood cancer is chemotherapy.
Okay.
And aside that, we might either add surgery, radiotherapy, or targeted therapy, depending on what the specific type of cancer. Okay. So it's not the same thing for everybody. Depending on what you have, then we treat you for that. Immunotherapy and stem cell transplant is not done here. In the advanced countries, that's what they do. But we usually do the chemotherapy, surgery, and radiotherapy. Yeah, so that is the treatment. And in Ghana, we have 3 major treatment centers: Korle Bu Teaching Hospital, Komfo Anokye Teaching Hospital, and the Accra Regional Hospital.
Okay.
But we have shared care centers, meaning that they can't do the whole treatment.
Yeah.
So they'll diagnose and refer to any of the 3 major treatment centers. So wherever you are, once you are diagnosed, once you have some of these symptoms, just present to the nearest facility. Okay. They'll run a few investigations. If there need be, they'll refer you to any of these major treatment centers. Yes, exactly. So that's a set for cancer.
Okay. All right, and it is at this point where we are talking about treatment of childhood cancers that we are definitely going to bring the conversation to what Alliance International Club has for children who are suffering for cancer. And so Na and myself are going to go over to the other side and get seated with Lion Friedrich, where he's going to give us all the details. So Na, please, let's move on to the other side. Kindly sit by Lion Friedrich right here. Okay.
That was great.
Okay, all right. All right, so we are still here. It's all about Good Living segment where we are still talking about childhood cancers. And so many things have been taught. We've learned something today from Na Mateki. And so, yeah, we are still here, and Lions International Club are here to share with us exactly what they have for us. Now, that was a very good presentation, by the way, so thank you for giving us some more in-depth into childhood cancers. And please, like Na did mention earlier, when you notice any of these symptoms that were highlighted during the presentation a few minutes ago, please make sure that you take your child to the nearest health facility just to be sure that your child is safe. And because, unfortunately, because of late reporting, that is the reason that we keep on having, you know, the cases not going as high as we expect it to be, for there to be treatment, proper treatment for whichever child that needs it. And so I did say early on that Lion Friedrich is here with us this morning. He's from the Lions International Club. Hi, Lion Friedrich.
Hi.
I know I definitely have to add a lion to it, but...
Yeah. You just say Lion Frederick.
Okay, so that's why I just said that.
Okay.
Good morning to you.
Good morning,
How
madam.
are you?
I'm good.
How did you feel about the presentation that we, Na just gave related to childhood cancers?
Oh, okay. Thank you very much.
Okay.
Thank you, Amines, for taking us through these statistics.
Yes.
When you listen or when you watch the statistics, you realize that it's of serious concern.
Yeah.
Not only to the Lions Club,
yeah.
but also Ghana as a whole.
Yeah.
Because we don't have treatment for the children undergoing cancer. So we took it upon ourselves as Lions Club International, which are into 8 global courses, which we undertake. So this month of February, we decided to concentrate on childhood cancer, whereby we partner with other organizations and individuals to help children who are undergoing treatment at Kolebu Teaching Hospital.
That's really incredible. And I wanted to wait for us to be seated with Na, so I would ask her this question. Now, when it comes to the treatment of childhood cancer, is it expensive? Because I know that it is probably one of the reasons that a lot of parents would avoid the hospital.
Yeah, it is quite expensive.
Okay.
I can't afford it. I can't afford it.
Right.
And unfortunately, because at times when the condition starts, most families would have gone from one hospital to the other.
Yeah.
So by the time they get to the major treatment centers, they would have exhausted all their funds. So by the time they get there and we tell them that this is the treatment and this is what they would need, they get heartbroken, and some of them would want to go home because they will tell you frankly that they cannot afford.
They can't afford it.
And it's expensive.
Yeah.
Their medications are expensive.
Oh, my goodness. Lions Club, then you are doing a good thing if you're going to take it upon yourselves to, handle it yourself. So what specifically would you be doing?
Okay. Thank you very much. So this Saturday, which is the 15th of February, is Childhood Cancer Day.
Okay.
So Lions from Accra Ubuntu Lions Club and Accra Jinyame, together with Accra Ubuntu Leo Club, are going to do some presentations to children undergoing treatment at the Kolebu Teaching Hospital, where we are going to give them thermometers. We're going to give them items that will help them for their treatment. So that's what we're going to do, and it's going to start from 8 a.m. till 12 p.m. on Saturday at Kolebu Teaching Hospital.
This is really good. And thank you so much for doing this for the children, and especially parents as well who may not truly afford it. I believe we have a number of patients in the hospital who are still there and are unable to afford treatments. And so there are piled up bills there, right?
Yeah, we have.
Approximately about how many?
So currently we have a ward capacity of about 24 patients and a daycare capacity of about 14.
Okay.
So they are still there. They need chemotherapy, aside those who have to work in every day, who cannot buy their medication.
Yeah.
So a day, if I should tell you, a day we spend about 20,000 buying medication for patients and doing investigation for patients. Exactly. So we need a lot of philanthropists to walk in to assist us. Because once they're not taking their medication, it's like they're not taking their treatment. It's like you're telling them that we've signed your death warrant. And that is not what some of them, they came in early, so we need to kind of help them to go through their treatment. So we need everybody on board, the government, everybody on board, so that we can help these children.
Definitely, we are going to stand and use this opportunity to call all and sundry philanthropists. If you're there and, you're touched by what is happening so far on Prime Money right now, and we would want to contribute, like Na did mention, the children are the future, and unfortunately, they are going through this. So please, if you can contribute one way or the other, cash or kind, please. I believe that the Kolebu Teaching Hospital, the Children's Care Unit, are open for this contribution. Please, we are calling all of you to do the needful. Lion Friedrich, before you go, what would you want to tell viewers out there? And I want you to reiterate the donations that you'll be doing again.
Okay, thank you very much once again. So what's so intriguing about the statistics that we got from Kolebu is that we understood from Kolebu that 50% of the children undergoing this treatment abandoned the treatment because of lack of funds. So please, we are entreating our philanthropists, as you said, individuals and organizations to come on board to help us to support the children who are undergoing this treatment, because the children are our future leaders. So we should try as much as possible to help them. So come this Saturday, 8 a.m. at the Kolebu Hospital, that is the cancer unit. We are entreating people to come on board to support. Also, if you want to donate something to help this worthy cause, you can kindly call on these numbers that I'm going to say, I'm going to mention, which is 0244 496676.
Okay.
0244 496676. And this activity is being championed by our committee chairperson, who is also known as Lion Na Ajele, who is doing an excellent job. You can also contact her so that you help in donating to support this worthy cause. Her number too is 0245 998472. 0245 998472.
Now, do you have a number of philanthropists or organizations come support?
Yeah, we have quite a number.
Okay.
So I'd like to say thank you to World Child Cancer, to Lifeline for Childhood Cancer, to ICGC, and to Emmanuel Methodist, They have been the sole supporters of the Pediatric Oncology Unit and others. So we have a lot of people working in to support the children. I want to say thank you to all of them. And thank you to Lions Club. They usually help us create a lot of awareness. So every year they come and call us to help create awareness, so that so that we'll diagnose them early, so that they would have a cure. So, and I'm using this medium once again to call on all philanthropists, all organizations who want to do something for these children. So please come in and help our children.
Before you go, when we were doing the presentation and you were talking about the symptoms, you did mention that parents should not just go to the pharmacy to buy drugs and give to their children.
Exactly.
Aside of that, what would you highlight as most importantly parents should not do when it comes to detecting any of these symptoms?
They shouldn't. It is, in as much as we are spiritual, as Ghanaians, we are very, very spiritual. If anything should happen, please, we should report to the facility.
And not
we shouldn't go to the religious bodies, in quotes, please.
Okay.
So that, because one thing we've noticed is that when they go there, when it becomes bad, the religious bodies kind of refer them back to the hospital.
Yay.
So please come to the hospital. God is everywhere.
Yes.
Even in the hospital, when we pray, God will listen to our prayers.
Amen.
So they should come to the hospital.
Amen to that.
So that we do what is right for the child. Yes.
Right.
Then,
okay.
Yeah.
Now, Mateki, thank you so much for your time this morning. Lion Friedrich, thank you so much for your time this morning as well. Unfortunately, we have to go.
Okay, before we go, I would just have to say a big thank you to Joy Prime for giving us this platform to create the awareness. So we are most grateful to Joy Prime for this platform. Thank you very much.
All right, thank you as well. It's all about childhood cancers. My guest has been Naama Mateki. She is an oncology nurse specialist at Korle Bu Teaching Hospital and a rep for from Lions International Club. Lion Friedrich was here as well. Well, before we go, we have to go over to the Accra Metropolitan Assembly where the Council of State voting is currently ongoing. So Colin is on phone. Hi, Collins, if you can hear me. Okay. Collins.
Yes, I can hear you.
Okay. All right, Collins, kindly go ahead and give us some updates in relation to what's happening.
Yes, I can hear you.
Yeah.
Right. As the Constitution demands in Article 89, which talks about the composition of the Council of State and also its functions and composition, today is the day that the Electoral Commission has paved the way for the election of representatives onto the Council of State. And across the country, we are expecting 522 people to cast their vote today, and 154 people or 54 aspirants, with 144 being males and 10 being females. But when it comes to the Greater Accra here, we have 13 aspirants and none of them is a female. We are expecting 58 people to cast their vote today, as being scheduled by the Electoral Commission. As at 7 a.m., polls opened, but none has come to vote today. So that's the situation so far. Before 10 a.m., nobody has come to vote. But we have people here, the aspirants here, the Electoral Commission, everybody has set up and ready to allow voters to come and cast their votes at the moment. But Collins, as I'm speaking to you, nobody has voted so far.
Okay, Collins, few seconds, just address this. What could possibly be the reasons that all of these 58, none of them have come to vote as of now?
Officially, we don't have any reasons assigned to why voters have not cast their votes so far.
Okay.
But I am tempted to believe that that's the usual last-minute things that Ghanaians do. So voting is supposed to commence from 7 a.m. and it ends at 5 p.m. So from now, 10 a.m. till 5 p.m., we can have time for the 58 voters to come and vote. But apart from that, security is also in place. The Ghana Police Service are ensuring that everything goes well here at the Greater Accra Metropolitan Assembly.
Okay, Collins, thank you so much for your time this morning. We'll bring you some more updates. Continue staying with us right here on Joy Prime. And that's it for today's edition of Prime Morning. My name is Esiedua Akomia. KMJ was here with me as well. We'll be coming away again tomorrow. Do take care of yourself and enjoy the rest of your day.